Okay, this is a story that came out March 7th, 2018 in Pennsylvania Live. Pennsylvania sees an 81% rise in ER visits for opioid overdoses. Pennsylvania has been struggling really bad. There's a lot of rural areas in Pennsylvania, and those are the areas that are hardest hit across the country. And it's not getting better since they declared their state of emergency. It's still pretty bad. And on this chart that you're looking at, the states in white have not reported any data to the Center for Disease Control. And as you can see, like you see like a lighter blue, those are states that had a slight 1 to 24% increase in emergency rooms for opioid overdose. The darker blue, the more solid blue, is 25 to 49% increase in the darkest blue that you see on here, which is 4 states: Pennsylvania, Delaware, Wisconsin, and Illinois. In fact, Delaware has been in the news a lot because the opioid plague is exploding there now. So, as you can see, those are the states where it's increased 50% or more for hospital emergency room visits due to opioid overdose. Pennsylvania saw an 81% increase in hospital emergency department cases involving opioid overdoses in the 12 months leading up to last September. That rate of increase was the third highest in the country, behind only Wisconsin, where overdose cases went up 109%, and Delaware, where it went up 105%. Now, Delaware is a tiny state, but they are struggling with an opioid problem. It is really, really bad there. I've heard it several times in the news recently, very recent. The statistics released Tuesday by the U.S. Center for Disease Control and Prevention are from 16 states that receive federal grants to help them better track hospital ER visits caused by opioids. The purpose is to better understand and improve the response to the crisis that has made drug overdoses the leading cause of death for Americans under 50. The vast majority of fatal overdoses, about 2/3, involve a legal or illegal opioid painkiller or heroin. A few of the 16 states saw a decrease in ER overdose cases, but only that of Kentucky, with a 15% decrease, is considered statistically significant. The data shouldn't come as a major surprise in Pennsylvania, which has ranked near the top on assorted measures related to the opioid plague, including total overdose deaths and per capita rate of overdoses. In issuing it, the CDC also offered recommended actions, including making medication assisted treatment immediately available to overdose survivors. Governor Tom Wolf in January declared a statewide 90-day emergency due to the opioid overdose crisis. The response plan include allowing emergency room doctors to start overdose survivors in medication. Pennsylvania also is expanding a warm handoff program that strives to steer overdose survivors into treatment. But also remember, if they are adults, they can refuse treatment, and there's really nothing they can do. So there you have it, ladies and gentlemen. Overdoses are still soaring in the state of Pennsylvania despite the fact that they declared an emergency. Please tell me what you think. Please leave your comment and subscribe. Don't forget to hit on the notification bell twice and join me on Black Junction TV and blackspot.com. Peace, family.